So I want to talk about first about rose canker, because many of you may have just started trimming back your roses. It would have been several weeks ago or so that you were trimming back roses. And so I want to talk a little bit about rose canker. So I brought this sample in. I want to give a shout out to our growers and sales yard team. I scoured the garden center looking for a sample of rose canker and could not find one anywhere, which is wonderful. One of the reasons why you do get rose canker, or one of the places you get it, is from what I'll just call bargain roses. Cheap ones that are produced in mass and sold in big box stores, things like that. Many of those come with canker because they don't take the time to clean the plants, trim them out, and do what's necessary to prevent it. So I did find this in the landscape, and it is there's a canker. It's kind of a dark spot, and again, I don't know how well this shows up on the camera, but you can kind of see this dark lesion right along here, and then it's typical. This is just a dead stem now, but kind of normal grayish for a dead stem, but you've got this black discoloration there. So rose canker is a fungal canker. It typically starts off as very small spots on a healthy green cane. So if let me just snip off a green cane off of this rose here. So this is a nice healthy cane right here. So we've got mostly green. There's a little bit of sort of reddish coloration that is totally normal, especially on new growth. So the new growth, you can see up at the top here, the stem is mostly red towards the top. In the larger, thicker areas of the stem, as you work your way down the plant, it's nice and green. Oftentimes the new growth on many roses comes out red. That is totally normal. It basically just means that the chloroplasts have not started firing yet, if you will, and so they haven't produced chlorophyll, which is green, and so you've got the red coloration. As soon as the chloroplasts kick in, then they're going to go to that nice normal green color that you see down here. But this stem is nice and healthy, but when you start to experience canker issues, which I do see a lot in the landscape, it starts off with very small black, purplish, sometimes even brownish, little tiny, not tiny, but small spots or lesions on the stem. And then it grows into a canker like this right here. And generally what happens when the canker works its way all the way around the stem, it girdles the stem. So girdling basically just means that it has in this case, the disease has cut off the flow of water and nutrients from the root systems up to the top of the plant. And so effectively it has stopped the flow from that point on, and then typically the top, anything above that will die off. So there's a couple things that you can do to prevent canker or treat canker. So when you do see it, you can go back about 2 inches below a canker and trim it out. That is usually very, very effective. So sometimes it's just a little bit here and there. Take it out, remove it, get rid of the the canker infected material, burn it. I wouldn't keep it around the garden, that type of thing. Put it in a lawn bag, give it away, whatever. But that's what I would do for for canker. The other couple things that I wanted to talk about in relation to canker is just proper sanitation. Now this is true of really basically all of the rose disease problems that are out there. Sanitation in roses is really important. So by sanitation, I mean a couple of things. When you have an infected cane, trim it out, get rid of it. In the case of things like black spot, which we'll talk about a little bit, black spot, powdery mildew, things like that, we want to clean those plants up and we want to remove that infected tissue.